Hello, my name is Dr. Bob DeMaria, and today we're going to talk about cholesterol. And let me tell you, there is so much confusion and controversy about cholesterol. I see it every day in my practice. So this is what I have seen about cholesterol. Cholesterol is the basic building block for all steroids. Steroids are components that help your body function properly. But this is what I want you to wrap your brain around. Cholesterol goes through steps and becomes something in your body called cortisone or cortisol. Cortisol puts inflammation in the body out. So I want you to think of cholesterol as a fireman. Now in the human body, cholesterol cannot float in blood. So it needs to go on a passenger vehicle, which we're going to call a fire truck or a lipoprotein. Well, in the human body, the LDL truck takes cholesterol to the fire. So what happens to so many people is they go to the healthcare provider and they have a blood test done and their LDL is elevated. So the well-meaning healthcare provider wants to give that patient a medication to help put the fire out. So in the human body, if you have a fire, your body's going to have an increased LDL. And what's the LDL doing? It is putting the fire out. Now, unfortunately, it's shooting the fireman on the way to the fire. So if you're taking a very common medication that takes the cholesterol out of your body, you may have pain in muscles and joints and optic stroke and glaucoma. Here's the question that nobody ever seems to ask. What's causing the fire? So what I have learned from my experience is some of the most common causes of elevated cholesterol is, number one, people like to eat sugar. Sugar causes inflammation. And when you have inflammation in your body has to get rid of it. So your body needs cortisone. Where does the cortisone come from? I mentioned to you at the beginning of the segment. Cholesterol becomes cortisone. Think of cortisone as the water that puts the fire out. Something else that happens to people, it's called stress. Hello, does anybody in the room have stress right now? Well, stress also compromises your adrenal gland. Your adrenal gland, once it's not functioning optimally and it needs more cortisol, it literally goes, brain, yes, adrenal gland, I need more cortisol. And so what does the brain do? It makes cholesterol, and the cholesterol is used to make more cortisone. So, a couple drugless action steps. What's causing the fire in your body? Maybe you need to cut back on sugar. Sugar can stress your adrenal glands, and your adrenal glands make natural cortisone. Now, from my experience also, an action step is you want your liver functioning optimally. Maybe some milk thistle. Milk thistle promotes optimal liver function, and the liver helps process the cholesterol. And finally, helping those adrenal glands along the way, make sure you're getting some sleep. What does sleep have to do with cholesterol elevating, Dr. Bob? Your adrenal glands need rest. Sleep, cut back on that sugar, and get yourself some milk thistle that promotes optimal liver function. I'm Dr. Bob DeMaria, the Drugless Doctor.